An Inside Look into Anemia, Chapter 2. Charlie, Jess, Isha, and Ashley. The hematopoietic function contains plasma, which is the liquid protein, leukocytes, which are the white blood cells, and erythrocytes, which are the red blood cells.
Hematopoiesis is the process of blood formation. This begins during early embryonic development and only typically in red blood cells. Later, it's controlled with the spleen, the liver, and the bone marrow. In adults, you typically see this in the bone marrow.
So what is the SR on patient 2?
The lymph system is also important in hematopoiesis, so you start seeing this process in the lymphocytes, the liver, spleen, and lymph nodes.
And having decreased
of course,
energy.
With age, the number and function of blood cells decreases over time, and this rate typically depends on the bodily needs in order to replace the old blood cells. So this is happening via using hematopoietic stem cells that mature in various locations.
And she states that she has no history of
Erythropoiesis
smoking or
is
drinking.
the formation of red blood cells in response to hypoxia or ischemia.
Unmanageable.
So
And
this
the patient's
uses
blood pressure is
precursor
140
stem
over 80
cells,
with a radial pulse
vitamin
of 92.
B12,
Her
folic
temperature was
acid, and
99
iron.
degrees Fahrenheit. For the
During
labs, her
maturation, the
hemoglobin
cell
was 7,
shrinks
her
and expels the
hematocrit was
nucleus,
28%,
and it becomes a
the
reticulocyte,
was 10%,
which later matures
and her white
into a
blood cells
erythrocyte.
were 12.5. For the assessment, the patient's skin was a slight yellow in color, and she had an irregular radial and brachial pulse. The recommendation for this patient is initiating appropriate management and following up with her PCP regularly to monitor the red blood cells. Obtain a chest x-ray to rule out acute chest syndrome and a blood smear to confirm the shape of the red blood cells. Discuss triggers for sickling and the importance of early treatment.
Aplastic anemia. It is bone marrow depression of all blood cells, also known as pancytopenia. The causes are idiopathic autoimmune conditions, medications or treatments, viruses, toxins, infectious diseases, pregnancy, or cancer. The manifestations are anemia, leukocytopenia, and thrombocytopenia. The diagnosis is through complete blood count and bone marrow biopsy. In terms of treatment, management of underlying cause, oxygen therapy, infectious control and treatment, bleeding precautions, hematopoietic stimulants, immunosuppressant therapy, or anti-infectives along with blood transfusions and bone marrow transplant.
So, anemia is a common disorder of erythrocytes that impair the blood's oxygen carrying capacity. This can be caused by three things: either a decrease in circulating erythrocytes, reduction in hemoglobin content, or the presence of abnormal hemoglobin. This is manifested in weakness, fatigue, pallor, or syncope, and the treatment really depends on what type of anemia that you have.
Sickle cell anemia is an inherited codominant disorder where the erythrocytes are crescent or sickle-shaped. Causes of sickle cell anemia is hemoglobin S, which distorts or misshapes the erythrocytes. Individuals with sickle cell anemia experience abdominal or bone pain, dyspnea, delayed growth or development, fatigue, fever, jaundice, pallor, tachycardia, ulcers on lower part of the legs, angina, excessive thirst, frequent urination, priapism, vision impairment, frequent infections, acute chest syndrome, splenic sequestration, and stroke. Diagnosis of sickle cell anemia include hemoglobin electrophoresis, complete blood count, and bilirubin tests. Treatment of sickle cell anemia include medication, avoiding triggers, oxygen therapy, hydration, pain management, infection control, vaccinations, transfusions, stem cell or bone marrow transplant, and genetic counseling. Overall, sickle cell anemia is rare and fewer than 200,000 U.S. cases per year arise. With the correct management strategies of sickle cell anemia, there's an improvement of life expectancy.
Iron deficiency anemia occurs when supply of iron is inadequate to meet the demands of hemoglobin production. This is caused by decreased iron intake and absorption and increased bleeding. It's manifest as cyanotic sclera, brittle nails, decreased appetite, headache, irritability, stomatitis, pica, and delayed healing. Diagnosed as a complete blood count, so checking low hemoglobin, hematocrit, MCV, MCHC, serum levels, transferrin saturation, and the treatment is identifying and addressing the cause, as well as taking supplemental iron intake and supplemental vitamin C intake.
Pernicious anemia is a decrease in red blood cells when the body is not able to absorb enough vitamin B12. Common causes of pernicious anemia include a weakened stomach lining or autoimmune conditions. Manifestations of pernicious anemia include bleeding gums, diarrhea, impaired smell, loss of deep tendon reflexes, anorexia, personality or memory changes, a positive Babinski sign, stomatitis, paresthesia, or unsteady gait. To diagnose pernicious anemia, serum B12 and antibody testings are done, CBC, reticulocyte count, peripheral blood smear, gastric analysis, and bone marrow biopsy can be done. Treatments of pernicious anemia include B12 supplement intake, which can be given through injection, orally, sublingual, or nasal. If pernicious anemia goes untreated, it can cause heart and nerve damage. Overall, there are more than 200,000 cases in the U.S. per year for pernicious anemia, and if treated correctly, a person with pernicious anemia is able to live a healthy life.
Hello, I'm Charlie. I'm going to be your nurse today. Can I have name, date of birth?
Isha, April 13, 2002.
Very good, perfect, thank you. All right, so what's brought you in here today?
I've been having bleeding gums, a little bit of diarrhea. When I walk, I'm unsteady, memory loss, and yeah.
All right, so I'm going to do a few tests. We're going to check your heart, we're going to give it a listen, and then we'll see what's going on.
Okay.
Hello. How are you doing, Isha?
Good.
I have a few results for you. We're going to go over a few things. All right. So, according to your B12, it's low. So, typically it is around 200 to 900 picogram per milliliter, and you're at 101. So, that is pretty low. While we were assessing everything, I took a listen at your heart, and we did notice there's a murmur, which is typically often due to turbulent blood flow due to anemias with your low viscosity. So, after reviewing the antibody testing and your blood smear, we found out that you have pernicious anemia. All right.
So what do I do now?
So typically what we do is a B12 shot, usually intramuscular, and then from there we're able to check your labs, make sure it's still at a good level. Your doctor will be in to discuss anything further, but did you have any questions for me in the meantime?
No, I'm okay for now.
Okay.
Thank you.
No problem.
Hello. Hi, can I come in?
Mm-hmm.
Okay. Hi, my name is Jess. I'm going to be your nurse today. Can you just tell me your name?
Ashley,
Okay, Ashley, and your date of birth?
August 20th, 2001.
Okay, all right, very good. So what brings you in today?
So I've been feeling a little bit tired lately. I've been getting 9+ hours of sleep and I still feel exhausted. And it's really just kind of cutting into my social life. I'm feeling these sharp and stabbing pains in my arms and my legs.
Okay, all right. Can you tell me when this pain started and what it feels like?
Yeah, so as a kid, I would get sick often and I wouldn't be able to recover. And then right around 12 years old, right around when I got my period, I started having like these sharp stabbing pains and I would feel like this low energy. And usually what makes it better is when I'm hydrated, and the things that make it worse is when I'm exercising to like a high degree.
Okay, do you have any family history of any diseases or disorders that you know of?
Yeah, so my mom has anemia and my dad has COPD and hypertension. And cancer also runs on my mom's side.
Okay, have you ever had any prior hospitalization, surgeries, or procedures in the last 2 years?
No, I haven't.
Okay, do you smoke or drink?
Nope, I don't.
No, none. Okay, no problem. I'm looking at your blood results now and it looks like the doctor indicated that your hemoglobin levels and the CBC came back abnormally low and you have an elevated reticulocyte count. On your hemoglobin electrophoresis test, the physician noted that the hemoglobin S was primarily present in all of your blood, which is an indication of sickle cell anemia. We will run your specimen for a blood smear to confirm the shape of your red blood cells.
Okay. So how does this type of anemia occur?
So typically, sickle cell anemia is inherited in an autosomal recessive pattern, meaning a person must inherit the sickle cell gene from both parents to have the disease.
Okay.
This condition affects your red blood cells. Normally, your red blood cells are round and flexible, which allows them to move smoothly through your blood vessels and carry oxygen throughout your body. But in sickle cell anemia, the red blood cells become rigid and shaped like a crescent or sickle shape, which is how it gets the name sickle cell. There's a constant shortage of healthy cells due to the shorter lifespan of cells in your circulation.
Okay. So how do I manage my symptoms in this new diagnosis?
So managing sickle cell anemia involves a combination of lifestyle changes, medications, and medical treatments to help relieve the symptoms and complications. Some ways to manage your conditions would be to stay hydrated, as dehydration can trigger a sickle cell crisis, and continue pain management as needed. I know you mentioned you take Tylenol frequently. You should think about switching to NSAIDs like ibuprofen due to the long-term use of Tylenol and the stress it may put on your liver. There is also folic acid supplements which can help with the production of red blood cells. It's also important to avoid extreme temperatures, as this could also be a trigger for sickle cell crisis. And make sure you keep up with regular visits with your PCP to monitor your condition and catch problems early.
Okay, so are there any recommendations I should consider for this new diagnosis of sickle cell anemia?
Yeah, because sickle cell anemia is the condition that affects your red blood cells, you are predisposed to being immunocompromised. What that means is you are more susceptible to getting infections or a higher risk of getting sick. So you should practice proper hand hygiene and take precautions such as wearing a mask when out in public or around sick individuals. I know it will be hard, but try to avoid big gatherings that would put you at this risk.
Okay. Thank you for explaining that super clearly. Now I feel like I know how to manage my symptoms and my new diagnosis. I mean, it is a lot to take in. It is a, hard pill to swallow, but I feel like I know how to manage it now. Thank you.
Okay, you're welcome, and thank you for coming in.
So now we're going to talk about SBAR on patient 1 and 2. So SBAR was created to facilitate clear and concise communication in high-risk situations, such as healthcare settings. It provides a structured framework for transferring information, ensuring accuracy, and reducing the potential for communication breakdowns. So to start, we have the situation. Isha is a 22-year-old female here to evaluate her memory, her gait, her diarrhea, and the fact that she has no smell. The background is she has no history of hospitalizations, surgeries, or any procedures. She has a clean bill of health. The assessment is, according to patient, serum B12, they are down to 101 picograms per milliliters. Typically, values can be between 200 and 900. Upon listening to the patient's heart, a murmur was noted, which is often caused by turbulent blood flow due to anemia through low viscosity. After reviewing her antibody testing, along with her peripheral blood smear, patient has pernicious anemia. The recommendation is a monthly vitamin B12 injection and a follow-up with her primary care provider for labs. So what is the SBAR on patient 2? The situation is Ashley is a 23-year-old female who is complaining of fatigue after 9+ hours of sleep and feeling lethargic and having decreased energy. The background is she has no history of hospitalizations, surgeries, or any procedures. However, the patient mentions a family history of a mother with diagnosed anemia and a father who has COPD and hypertension. She also mentions cancer prevalence on her mother's side, and she states that she has no history of smoking or drinking. The patient takes Tylenol for pain relief when symptoms become unmanageable, and the patient's blood pressure is 140/80 with a radial pulse of 92. Her temperature was 99 degrees Fahrenheit. For the labs, her hemoglobin was 7, her hematocrit was 28%. The reticulocyte was 10%, and her white blood cells were 12.5. For the assessment, the patient's skin was a slight yellow in color, and she had an irregular radial and brachial pulse. The recommendation for this patient is initiating appropriate management and following up with her PCP regularly to monitor the red blood cells. Obtain a chest x-ray to rule out acute chest syndrome and a blood smear to confirm the shape of the red blood cells. Discuss triggers for sickling and the importance of early treatment.
Thanks for watching!